Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hi, Emma.
I've got a question here from a young mum who says, my baby often seems to be in pain after feeding. How do I tell if this is colic and what should I do about it? So many people want to hear the answer to this.
This is a very, very common problem, and I think there are very few babies actually who don't get a bit of pain at some point. And it's often put down to colic to begin with, and then a bit later maybe it's teething pain, and everybody wants to have an explanation. And I think first of all you need to think about how severe is this pain, and the sort of baby who has real colic, sort of baby who's drawing up their legs, and you can tell from their cry quite quickly this is a painful cry. It's not a hungry cry or a demanding cry, it's a I'm in pain, and they really do look upset. And that might be the sort of baby who has colic, but it may also be the sort of baby who has what we call reflux, and that's what I wanted to particularly bring up today, because reflux is quite common. And what happens here is that babies, when they swallow, most of the milk should remain in the tummy. But many babies have what's called reflux, which means that milk will come back up inside their esophagus or their gullet and cause pain because the contents of the tummy are acid. So that burns inside, and some babies really seem to be in pain immediately after eating. And if that's happening, you do need to go and see your doctor, because there are medicines which can help. Not only medicines that are going to thicken the milk and help keep it down, but also medicine that will prevent the acid from coming back up, or will prevent the vomiting if your baby's also vomiting.
So if you get the right medicine, that's something that will be tackled quite quickly.
Quite quickly. So it's important to go, if your baby seems to be in pain after feeds, it's important to go and see your doctor and talk it through.
Do you think sometimes for new mums they're looking at their little ones and just seeing that sort of discomfort of wind, because wind can be uncomfortable, and then thinking that that's more serious than it is?
Exactly. And actually this is also where your health visitor comes in, because deciding between the two is often very difficult if you're a brand new mum, and babies will sort of whinge and be a bit windy and sometimes go a little bit blue around the mouth and then
screw up their faces.
Screw up their faces, and then they'll settle and then they'll be comfortable. And I think it's often helpful if you don't have a clue. Either ask an experienced mum, a friend, your own mum, somebody that you can say, is this normal or not? Or your health visitor. These are the people that are really going to be helpful to begin with.
And are really happy to answer these questions, aren't they?
Yes, exactly. Yes.
Good advice as always, Sue. Thank you very much. And if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.